Okay, so the idea now is to talk about tinnitus and its types. There are main two types we can talk about. The one is the non-pulsatile tinnitus, and the other one is the pulsatile tinnitus. When we are talking about the non-pulsatile tinnitus, it is almost always subjective tinnitus. Namely, there is not really a sound that causes the tinnitus, the ringing in the ear, but it is something that the brain, let's say, cause it. It's usually perceived as some kind of sound that is not pulse, namely something like buzzing or ringing in the ears, and things like this. Now, this subjective tinnitus or non-pulsatile tinnitus can be caused by a variety of reasons. For example, hearing loss from aging, hearing loss from acoustic trauma, hearing loss from medication toxicity, glycoside, diuretics like furosemide, aspirin, and things like this. And it can also be caused by tumors. The most common one is the cerebropontine angle tumor, which is the most common. There is the vestibular schwannoma on the 8th cranial nerve, which can cause hearing loss, but also tinnitus, which is non-pulsatile tinnitus, which is this ringing can be in the ear with a hearing loss. There are also other causes that can cause non-pulsatile tinnitus. They are less common, for example, multiple sclerosis and things like this. Now, when we are doing imaging for subjective or non-pulsatile tinnitus, we are looking for the causes. And the most common cause to do an imaging for non-pulsatile tinnitus is excluding or looking for cerebropontine angle tumors, namely mainly vestibular schwannoma, but not just vestibular schwannoma, but mainly. Now, you need to remember that when doing imaging for a non-pulsatile tinnitus, you may many times get a normal imaging result. The reason is that most commonly, the reason for non-pulsatile tinnitus is not an anatomical lesion, namely hearing loss from acoustic trauma or from aging. You won't see too much in imaging. I'm not talking about the patient with tympanic membrane perforation, which is also hard to see in imaging, but I'm talking about the patient with, hearing loss from acoustic trauma that cause hair cells damage in the cochlea, and you probably won't see it in imaging. What you mainly see again is the cerebropontine angle tumors, the vestibular schwannoma mainly. This is about the subjective tinnitus, the non-pulsatile tinnitus. Now, when we are going to talk about the pulsatile tinnitus, which can be subjective but many times objective tinnitus, namely there is something that causes this noise. Now, when I'm talking about pulsatile tinnitus, as the name suggests, we are talking about a noise that is like a pulse of the blood or a pulse of your heartbeats that you hear in your ears. Now, with the pulse of your heartbeat, you hear the tinnitus, like boom, boom, boom. Now, it can be caused by mainly three categories that can cause it. Number one, vascular tumors in the area, like glomus tympanicus, glomus jugularis, or glomus tympanologularis, which is vascular tumor in this area, jugular, in the area of jugular vein or in the area of the tympanic membrane. And now it is vascular, so if you are doing contrast enhanced, for example, a T1 weighted image, gadolinium enhanced, so you will see enhancement of this tumor in this area. This may be the most common tumor that can cause pulsatile tinnitus. Now, there is the second. Now, the first one is the tumors, we talked about it now. The second one is the vascular malformations. And the third one is the venous anomalies, or Yes, this is the main one. So tumors, mainly glomus tumors, glomus typanicus, glomus regularis. Second one is the vascular anomalies. For example, AVM, arteriovenous malformations, that can be a aberrant or pathological connection between an artery and a vein that can be in the area of the ear that can cause the patient to hear pulsatile tinnitus. The third category is the venous anomaly, which can be many aberrations or variants on the veins, like the jugular vein that go throughout here, but not just veins. Maybe I need to call it another way, because also artery that are aberrant can also cause a pulsatile tinnitus. For example, jugular bulbs or jugular diverticulum or jugular wall dehiscence in the area of the inner ear can cause pulsatile tinnitus. Aberrant arteries in the area of the inner ear can cause pulsatile tinnitus. Pulsatile tinnitus can be a finding in IIH, increased idiopathic increased in cardiac pressure, PTC, pseudotumor cerebri. There is a venous stenosis in the area of the inner ear, so it can again cause pulsatile tinnitus. So vascular anomalies, I should say, not venous anomaly. Vascular anomalies in the area of the inner ear can cause pulsatile tinnitus. So this is maybe the main thing that I wanted to talk about in the sense of tinnitus. Just to sum it up, we have subjective non-pulsatile tinnitus, hearing loss, acoustic trauma, medication toxicity, cerebral pointal angial tumors, also weird or more rare things in this as a cause of this, like multiple sclerosis, something like this. And we have the pulsatile tinnitus, which is more commonly an objective one with a, let's say, anatomical anomaly that causes it. For example, tumors, vascular malformations, and maybe should call it vascular anomalies. Thank you very much. If there are any mistakes or correction, I'm sorry. I hope that I made clear the main points about tinnitus. And this is it.